You two, on the other hand, favor single payer. To make the other case.
Yeah, well, I think we've got to get away from the insurance companies. I think that's the heart of the problem, that there are 1,500 insurance companies butting up against each other, competing with all these different forms. And we know from the Canadian experience, although I don't share all of the Canadian experiences as valid for the United States, that that was a huge savings for them, having a single-payer system. I don't think Mr. Shikoda's plan will lead to those kinds of efficiencies.
Actually,
Also,
Germany, which is a multi-payer system, pays less of their GMP toward health insurance than Canada does.
well, the United States has an outrageously high figure, and Canada showed that by cutting down on the insurance companies, that accounted for some 20% of their savings. Perhaps there are other factors in the German situation. But my belief on this is that you have a universal health care system with a single payer, but I agree with Mr. Shikoda that perhaps it doesn't have to be administered with a giant bureaucracy in Washington. As Congressman Dave Obey has said, this can be administered more at the state and local level as long as there is a national requirement and a guarantee that it would only be done through single payers rather than through all the insurers. Now, the other point I want to make about my thoughts on this is that if we don't have strong government regulation of health costs, if we don't have, for example, in Madison, Wisconsin, where there are several open heart centers, a requirement that we only have 1 or 2, which is wasteful, we won't get the benefits, and I don't think Mr. Shikoda's plan provides for that. And the last thing I'd say is that if this plan does not include extensive coverage for long-term care for the elderly and the disabled, we will not only betray the people that need the help, but we will miss the greatest opportunity for savings, which is to help people stay in their own homes in the community settings rather than paying $30,000 a year. These are all part of what I see as a universal health plan that would cover all Americans.
Mr. Moody.
For 2